Hi, Julie. Welcome to Occupational Therapy. Tell me a little bit about yourself.
I'm a 36-year-old female with 2 kids and a graphic designer and like to work out and lift weights.
Okay. Tell me a little bit about your medical history.
Well, 9 years ago, I had a tumor on my right ovary, a granulosa cell tumor, and had that removed. And ever since, have had to follow up with my oncologist. I didn't have to do any chemo or radiation, but just at the end of last year, I did end up having to have a full hysterectomy, and they did take my left ovary as well, and had tumors behind my uterus when they removed it.
Did you have any other underlying conditions?
I have a blood mutation, which puts me at risk, a higher risk for blood clotting.
Okay. Any other injuries or surgeries that you've had with your weightlifting or sports or anything?
Yeah, I've had shoulder surgery from a tear in my labrum and a hernia repair surgery in my stomach, where my belly button, a little above and a little below.
What was your most recent surgery?
The full hysterectomy.
Okay. Any other health issues right now?
Inflammation is something that I struggle with, and pain in my wrist.
Okay. So tell me a little bit about the pain in your hands and wrists.
Yeah, it's traveling from about here down into my 3 fingers, and I get numbness and tingling in my fingers when I'm doing work at the computer, and or even when I'm sleeping. At times I wake up and my hand is numb, my fingers are numb.
Would you say it's more numbness and tingling or more pain?
It depends on what I'm doing. During sleeping and things like that, it's just numbness. But when I'm doing weightlifting, I get pain more doing that.
On a scale of 1 to 10, how bad is your pain when you're weightlifting?
I would say at about a 6 or 7.
Okay. Have you noticed anything that it's impacting your functional life? Is it keeping you from doing other things that you want to do?
I definitely have loss of motion in it. I can't bend it back as far as my left hand will go, and it affects when I'm working because I'm a graphic designer, and so I use my mouse a lot, and I'm finding that grabbing and holding the mouse causes my hand to go to sleep, or like when I'm mowing or driving, anytime I'm holding something, I do get numbness and tingling in my wrist and fingers.
Are you having it in both hands or one hand more than the other?
Definitely more in my right hand. Sometimes I get it in my left, but it's not near as bad as my right.
Have you found anything that helps with the pain or the numbness?
Not using it.
Not using it.
Yes, just trying to hold it out. I've used some Advil, and it helps a little bit, but not as much.
Okay. So that's what's brought you to OT today. We're going to do a little bit of an examination on your hands and look at it and see if we can determine what's going on.
Okay.
Okay. So I'm going to take a quick look at your right hand right there. And what I want to do is compare it to your left hand and look for any differences. Do your hands look typical to you?
My fingers right now have been swollen. It's something I've been struggling with since I had my hysterectomy.
Anything else that's different in your hands? Have you noticed that you drop things anymore or you have difficulty gripping things?
I do have a hard time holding on to things without getting numbness or tingling.
Okay. And I do see some puffiness in your fingers. Just kind of some overall puffiness just through your fingers, through the tops of your hands. It seems like your rings are just a little bit tight, right? Mm-hmm. Okay. All right. All right. So I'm going to go ahead and I'm going to do some goniometer testing and test your range of motion in your hands. The other thing I'm going to do is do some sensory testing in your hands, okay?
Okay.